Most people believe diabetes can only be discovered through a blood test at the doctor's office. You go in, wait for the lab results, and only then learn the truth. But as a physician with over 20 years of clinical experience, I see proof of a completely different reality every single week. Your body begins warning you about high blood sugar long before any laboratory result becomes abnormal. And the very first place your body sounds that alarm is your feet. Last month, a 67-year-old retired man sat in my office. He felt perfectly fine. But before we drew any blood, I asked him about his feet. He said, "They have been a little numb for a while." But I assumed that was just age. That man had 4 of the 9 warning signs I am going to show you today. His fasting blood glucose was 214. He had been living with diabetes for over 2 years without knowing it. In this video, I will show you exactly what I showed that patient. 9 warning signs visible on the feet of millions of people right now, but almost never correctly interpreted. For each sign, what most people wrongly assume, what is actually happening inside the body, and one simple daily habit that can protect you immediately. The American Diabetes Association estimates that 1 in 5 Americans with diabetes does not know they have it. Millions of people with a silent disease quietly destroying their nerves, their kidneys, and their eyesight. A simple blood test costing around $12 can catch this early. But first, you need to know what to look for. To understand why your feet are the earliest warning system for diabetes, think of your blood as a delivery van transporting oxygen and nutrients. Your feet sit at the end of the longest delivery route in your entire body, further from the heart than any other part. When blood sugar remains chronically elevated, your blood vessels narrow and stiffen. Simultaneously, excess glucose attacks the protective outer layer of your nerves. When the roads narrow and the communication lines are under attack, the deliveries to the most distant station, your feet, fail first. Sign 9. Hair loss on the feet and lower legs. Almost nobody talks about this, and even many doctors overlook it. Hair follicles require a steady supply of blood and oxygen to function. When circulation is impaired by years of elevated blood sugar, those follicles quietly stop receiving what they need. Think of them like plants in a garden where the irrigation pipe is blocked. They do not die immediately, they simply stop growing. Visible hair loss on the tops of the feet and lower shins is a marker of vascular damage that has often been progressing silently for years. Sign 8. Chronically cold feet. Many patients joke they have always had cold feet, but when your feet are ice cold in July, even under thick covers, even when the rest of your body feels warm, that is a warning sign for peripheral arterial disease. Your vessels are so narrowed that warm blood cannot reach the extremities in sufficient volume. Like a blocked heating pipe, the room at the end of the corridor stays cold no matter how hard the boiler works. Daily habit. A brisk 30-minute walk every day forces circulation into the feet and strengthens blood vessel walls. Sign 7. Sharp, electric pain. One of the most fatally misdiagnosed signals. Many patients take ibuprofen for foot pain for months, convinced it is arthritis. When nerves are damaged by high blood sugar, they sometimes become hyperactive, firing random, intense signals that feel like knife stabs or electric shocks, most often at night, like a car alarm damaged in an accident that now goes off randomly. Nobody is breaking in. The alarm is simply broken. Anti-inflammatory medication does not help here. It only masks the signal. Daily habit. Stretch your feet and ankles for 5 minutes every morning and massage them gently each evening. Sign 6. Persistent swelling. Occasional swelling after a long day is normal, but permanently swollen feet and ankles with deep sock impressions every evening means your kidneys are involved. High blood sugar damages the kidneys, which regulate fluid balance. The filtration system becomes overwhelmed, fluid backs up, and gravity pulls it into your ankles. Press a finger into the swelling. If the indentation remains for several seconds, this is pitting edema and warrants immediate medical attention. Daily habit. Elevate your feet when resting and reduce your sodium intake significantly. Sign 5. Deep, unhealing heel cracks. Most people assume cracked heels are cosmetic, but when your heels are severely cracked in summer and no moisturizer helps, something deeper is happening. Diabetes damages the autonomic nerves that regulate skin moisture. Your feet lose their natural hydration from the inside out. Cracks in the skin are open doors for bacteria, and with compromised circulation, such an infection can end catastrophically. Daily habit. Apply coconut oil or a thick moisturizer to soles and heels every evening, never between the toes, where trapped moisture encourages fungal growth. We have covered the first 5 signals. We are now entering the critical danger zone. The next 4 signs stop being merely uncomfortable. They become genuinely life-threatening. These are the symptoms that send countless patients to the emergency room after months of being ignored. If you recognize any of the following, there is no room for delay. Sign 4. Skin discoloration. Around the ankles. This signal hides in plain sight. Patients notice their lower legs becoming darker, reddish, or faintly bluish, and attribute it to sun damage. But when circulation is impaired, the lower legs do not receive enough oxygenated blood. Skin starving for oxygen changes color and becomes measurably thinner and more fragile. Studies show these discolorations are detectable on average 18 months before a formal diabetes diagnosis. Daily habit. 5 minutes of ankle circles and calf raises each morning restores blood flow to these oxygen-depleted tissue layers. Sign 3. Small wounds that will not heal. The number one reason for hospital admissions in my practice. Patients arrive with a small blister from a shoe 3 weeks ago that simply will not close. With chronically high blood sugar, the body loses its healing capacity. Tiny blood vessels stiffen, oxygen and white blood cells cannot reach the wound fast enough. Imagine watering your garden through a severely kinked hose. The water exists, it simply cannot get through. Non-healing wounds lead to diabetic foot ulcers, the leading cause of non-traumatic lower limb amputations, over 100,000 per year in the United States alone. Daily habit. Examine your feet every evening. Clean and dress any cut or blister immediately. If it has not improved within 48 hours, see a doctor without delay. Sign 2. Burning soles at night. This symptom is psychologically devastating because it strikes at night when patients are alone and still. The sensation is of feet literally on fire. What is happening is a precursor stage of diabetic neuropathy, damaged nerves sending false extreme heat signals to the brain despite nothing hot touching the foot, exactly like a fire alarm with a faulty sensor. The building is not burning, but the alarm is deafening. This burning frequently presents 1 to 3 years before an official type 2 diabetes diagnosis. Daily habit. Drink 8 glasses of water daily and dramatically increase fiber intake at every meal, vegetables, legumes, oats. Fiber slows sugar absorption into the bloodstream significantly. Sign 1. Tingling and numbness. The most common and most ignored signal of all. Every foot falls asleep occasionally. But regular tingling or numbness without a clear positional cause is peripheral neuropathy, affecting nearly 50% of all people with diabetes. Think of your nerves as electrical cables with a protective coating. Chronically high blood sugar acts like an acid slowly eating through that coating. The cable still functions for a while, but the signals become distorted. That distortion is precisely the tingling you feel. Daily habit. A 20 to 30-minute walk every single day and the immediate reduction of added sugar in your diet. Not next month, starting today. 9 signals. 9 opportunities to intercept a devastating disease before it overtakes you. Tonight, before you go to sleep, take exactly 30 seconds. Sit down and look at your feet. Check the skin color. Look for cracked heels or open wounds. Notice any tingling or numbness. If you recognize even one of these signs, call your doctor tomorrow morning and ask for a simple blood glucose test. Diabetes does not have to be an inevitable fate. In the vast majority of cases, early detection means the disease can be fully controlled through straightforward dietary changes and regular movement. You have worked hard for your independence and your health. Do not allow undetected blood sugar to take that from you simply because you did not know where to look. Stay proactive, pay attention to your body, and take care of your feet.